Well,
Mr. Krekorian.
Thank you very much, Mr. President. Thank you, Mr. Kretz, for bringing this issue before the Council. I think that the importance of today's report is not so much talking about our response capabilities, because I think I and probably all of us have a very, very high degree of confidence in our emergency management department, our fire department, all of the other first responders, and of course county public health. I think the real importance of today's report, I hope, will be to begin the process of dispelling the highly irrational fear that is out there in the public about this disease. And I want to put it into a little bit of a context. There have been 4,500 or so deaths in 3 countries in Africa so far from this disease. In the United States, there will be 23,000 U.S. deaths from antibiotic-resistant bacteria. No one is flipping out about that yet. In the United States, there will be 500 deaths from tuberculosis, 3,000 to 50,000 deaths from the flu. When we had the H1N1 outbreak, there were 12,000 U.S. deaths, 100,000 deaths throughout the globe. So while Ebola is an important public health issue in West Africa, it is not a crisis in the United States. And people need to understand there is no Ebola crisis in the United States. And we just have to stop this fear-mongering. I'm tired of getting hourly Ebola updates from the news media when there is no crisis in this country. There will be fewer deaths from Ebola in the United States than there will be deaths by people hit by lightning this year. There are 50 lightning strike deaths a year. There will be significantly fewer Ebola deaths in the United States. We are now in a situation where a principal in Texas, a school principal, went to a funeral in Zambia, not even one of the affected countries, but he just went to Africa for a funeral, and parents in that school forced that principal to take paid time off because they were afraid of exposure to their children. There was another teacher who went to an education conference in Dallas. She stayed at a hotel 10 miles away from Texas Health Hospital, 10 miles away. And the school district decided to give her time off for fear that there might be an impact on the children. This is insanity. This is completely unassociated with any understanding of science or medicine. It is highly irrational fear, and frankly, it's being stoked by Republican political interests in order to try to find blame with the Obama administration, and it's shameful. And we shouldn't allow it. We should not be in a position of stoking fears. We as leaders should be in a position of trying to relieve people's fears. There is no Ebola crisis in America. I serve on the MTA board with Mr. Bonin. Just a week or so ago, we had a guy get on a bus with a mask on and say, "I have Ebola." So we had to take the bus out of service. All of the driver had to take time off. There's absolutely zero health risk there, and yet we have to respond this way because of people's fears. So I, for one, want to make it clear to everybody who's listening out there, you are not in danger of contracting Ebola. A member of my family said that she couldn't sleep at nights because she's afraid of Ebola. There is no risk that anyone in Los Angeles will get Ebola, period. And I wish that we could just start saying that out loud. I know you have to be the conservative, careful one, and I appreciate that because that's why we have such good response. That's why we have, such a high level of sophistication in our response to these things, because you all think it through. You think of the worst case scenarios. Our fire department always is thinking of the worst case scenarios and preparing for it. But the worst case scenario can't happen. It's virtually scientifically impossible. And so, anyway, I just wanted to kind of raise those points and see if there's other steps that we can take to kind of relieve the public's fear out there, still be honest about the need to be careful, but also to try to relieve this overreaction that people have, especially as we're going into the flu season. And as we go into the flu season, there's going to be people who are vomiting and having other symptoms that resemble the symptoms of Ebola. But not everybody who gets the flu has Ebola. None of them will. Is there some way that we can try to relieve people of that fear so our emergency rooms are not crowded with people who are fearing that they have Ebola because because they saw someone throw up or have a runny nose?
I think your comments are very excellent. I appreciate your positive comments about our capabilities. Thank you.